So hello everyone, I'm so sorry for the technical glitch, and for some time we were not connected, and there was some disturbance. So once again I am here, and with the Vivekananda's birthday, we paying tribute to him and acknowledging the fact that we lost such a big hero in his prime time. We could have gotten more from him, and he was a real asset for all of us and for all of humanity. So here also we start, the point, which is diabetes, which eventually led problems in Vivekananda's, health. Diabetes and high cholesterol can lead to heart attacks. And when it comes to cholesterol, I want to emphasize today is what are the cholesterol components and which cholesterol component we should be giving more focus and attention. So cholesterol components are, one is total cholesterol is written, but more importantly, there is a LDL cholesterol, which is a bad cholesterol, which makes the atherosclerosis process more active, and which is in fact responsible for atherosclerosis process. Then comes HDL cholesterol. HDL cholesterol is basically a good cholesterol, which takes away the cholesterol and takes into the liver and helps in metabolism of these kind of cholesterols, and we get rid of extra cholesterol by HDLs. So these are basically lipoproteins. And then third is triglycerides. So triglycerides, they are high triglyceride is basically seen in metabolic syndrome. Someone who is more obese, he's taking more carbohydrate, something like he is eating more cereals, basically bhat khabe, basically rice khabe, basically then he's taking more of rotis, chapatis, junk foods, high calorie diet, more of sugar, sweets. Then they get, or maybe he's taking more of beer and alcohol, then chance of hypertriglyceridemia is very high. And triglycerides, if they are high, they can lead to heart attacks. But if you bring down the triglyceride, your heart attack will be less. That is not a very fully established fact. Provided the triglyceride is very high, and by reducing triglyceride, we can get some relief from pancreatitis. So triglyceride is definitely important, but it is not the sole, cholesterol component which we are focusing at. So we focus at LDL. So LDL is the target. LDL more than 130, one should be alarmed of. And if it is more than 150, 160, more than 190, it is a lot of problem. High LDL for a shorter time also can lead to big problem. So say 190, 200 LDL staying for 6 months can have same effect of 140 cholesterol staying for 3 years. So high level as well as duration of high cholesterol, that is also that mutually brings down the problem, like atherosclerosis and plaque ruptures. So the basic fact is LDL is the target one should look at, and if you have heart disease, established heart disease, or LDL should never be more than 60. You should try to get it less than 60. If someone is diabetic, it should be at less than 100, preferably less than 70. And if a normal person should be having a less than 130, not more than that. If it is 120, 110, 100, it is well within normal limits. There are some genetic syndromes. So even if you eat less, for genetic syndromes like hypertriglyceridemia, hypercholesterolemia, familial hypercholesterolemia, your LDL will be higher, your triglyceride will be higher, and there your diet modification will not work. You require treatment only. And there it lies the importance of screening of everyone with cholesterol level, especially those who have family history. So आज की जो मैं कथा बोलची, that is mainly focused on high cholesterol, and the cholesterol component which is more and most bothering is LDL. So LDL of more than 130, one should be alarmed of, and less than 130 is okay for normal population. For diabetes, less than 100 or 70. For those who have coronary artery disease established, heart disease, should be less than 60. So these numbers I want my viewers, my friends to know, because this is very important. I tell you 1 to 3 things, 1 or 2 very important things. There are multiple risk factors which decide the chances of, happening of any problem. Like hypertension, diabetes, high cholesterol, these all three can lead to heart attacks also. These all three can lead to stroke also. But for heart attacks, amongst these three, the biggest factor is cholesterol. For stroke, amongst all three, the biggest factor is hypertension. So there lies the crux. If you want to reduce heart attacks, if you want to have a less adverse coronary events, then you should vouch for low cholesterol at all level. At the same time, you should also look at diabetes, hypertension, your obesity, your work style, and then smoking pattern. It should be absolutely zero. But if you are looking at your stroke chances reduction, then first priority is hypertension. Of course, then diabetes, cholesterol, and all will follow. So this is what I wanted to discuss with all of you today. A crisp 8 to 10 minutes video. We can have more questions. So and some discussions. So we have got some questions asking triglyceride from at what level we should give treatment. Triglyceride, if it is less than 200, absolutely no problem. Less than 150 is the best possible triglyceride. More than 400 triglyceride, you should start working and thinking of giving medicines. And that too not for coronary artery protection, that is for pancreatitis protection. But definitely, if you reduce triglyceride, they can definitely help. Even if it is not statistically significant, it helps in reducing cardiovascular events as well. So thank you so much again for being there. So 3-4 crux I will just repeat so that it goes in everyone's ideas. Is even if I am not obese, I can have high triglyceride, high LDL, and high cholesterol. Number one. If I have a normal cholesterol, I will never have heart attacks. It doesn't happen. It can happen also, but chances will be very high if you have high cholesterol levels, usually and specifically LDL. And then the worst cholesterol is LDL, which should be less than 130 at all cost and less than 60 in those who have established cardiovascular disease. And triglycerides definitely makes important, are important, but if it is more than 400, then we start medicine. Before that, lifestyle modification is the crux for triglyceride reduction. You have to have less carbohydrate intake, less of sweets, more of work, more of consuming your energy, working on that, and taking less of carbohydrates. So these are my today's discussion on cholesterol. I hope it would have given you some insight and some information. Thank you so much, and see you next Friday, same time, 6:30, for a short discussion and short interaction. Thank you so much.